Hello, and thank you for joining me for a very special day with a dog. I would like to introduce you to Bragi. He is an adorable, sweet, calm, loving Pomeranian. I was contacted by someone looking for a rescue for the little guy. Seeing the white muzzle, I asked if he was a senior and was told yes. So I brought him to the home of Misfit Pets. He was very matted, but Jessica at Posh Pet Cottage gave him an adorable cut the next day. That was when I noticed that something was very wrong with the way he walked. When I took him for his vaccinations, I brought this up with the vet. She told me he has luxating patella in both knees. This means that his kneecaps won't stay in place. He also has hip sockets that are too shallow. On top of this, he is not a senior. He's only about 2 or 3 years old. Bragi needs surgery. So I made an appointment with the surgeon, and this is what we learned.
And it's pretty straightforward what we got. So the front leg is exactly as it was portrayed. He had a fracture, old fracture there. Calluses formed, they're just in an abnormal location, but there's no change that we're going to do to that. The back legs are a little more complicated. He's got several things going on. First of all, the anterior cruciate ligaments on both legs are stable. They're not broken or torn. So that's good. The knees, the problem with the knees are that we have medial patellar luxation in both legs. They want to stay out more than they want to stay in. And that's not unusual on these little toy breed dogs. We see that as being a pretty common thing. What happens when they stay out for a long enough period of time, the normal pull of the ligaments will start twisting the legs and they'll start rotating. And you get the bow-legged appearance, and that's when you see him walking and he's walking bow-legged. Part of that is because of the knees. He's got some what's called tibial rotation on the x-ray. Now, those x-rays are not the best in position, and I'm not blaming them because he wasn't sedated for it. He was trying to get x-rays of the thing without giving him any sedation. Ideally, he should be sedated to get a good view that you feel confident you can say how much rotation is occurring in those tibias. So at some point he probably does need to be sedated and have some good views that you can really get more predictive with. But I will tell you, just looking at him, looking at the x-rays, we can tell that he already has some tibial rotation occurring. One of the legs has some pretty obvious arthritic changes in addition to the luxate, and that's a normal progression of what we see with these kneecaps popping in and out all the time. The hip on that right side is subluxated, and whenever you lay him on his side and you work it back and forth, it'll pop out of place. It'll pop out of his socket. So he's got a subluxating hip. The left side is very shallow also. It's not popping out of the joint, but it's actually is pretty close to being the same fix that the right one is in. All of these things probably are congenital. They're not due to trauma. They're due to the breed of dog and the congenital nature of what's going on here. However, they will compound themselves as he gets older. The tibials are going to rotate more. He's going to get more arthritic changes that will occur, and it will eventually cause him some difficulty being able to walk in a halfway normal fashion. So what can we do? We do know that the kneecaps and the hip popping out, in addition to affecting ambulation at some point, is that there's pain associated with that. That normal popping in and out, or the abnormal popping in and out as that bone pops across another bone, will elicit some nerve fiber ending pain. And so the reason for doing any type of surgery is twofold. You try to to reduce that pain that's occurring as a result of the popping in and out. And secondly, you try to slow down the development of additional arthritic changes and rotation of the tibia. Now I will tell you, even with surgery on the knees, that doesn't stop arthritis from happening. Arthritis is going to happen on this dog, I'm convinced of it. The reason for doing surgery, again, is to stop the pain and to slow down that arthritic change that's occurring. He's already got some. And then, so that's talking about the knees. The hip, the surgery for that is what's called a femoral head ostectomy, where you go in and remove the ball of the femur. It's like a hip replacement, except we don't replace it. You leave it unattached to the hip. And what goes through people's mind is that, well, how the heck are they going to use the leg if it's no longer attached with a joint there? And they do quite fine. And in fact, by doing that, unlike the knee, we can stop any arthritic changes in the hip because you're eliminating that joint. You're no longer having to depend upon that joint for function anymore. And so as a result of that, arthritis is not going to develop there. The problem with him, with Bragi, is that he's got so many joints that are affected here, both his knees and both his hips. He needs work on each one of those areas. Which one comes first is difficult to answer. The hip popping out probably, I would say, is your first step, only because that's probably the one that's going to cause him the most pain. As that hip pops in and out of that joint, it's you know, again, it's painful. If you talk to people that have a joint pop out and pop in, they can tell you that getting it back in or out is not a comfortable thing to happen. So I would think that that's probably the first one to address. And then you got the knees, and eventually at some point the other hip. I know one of your concerns is, and I appreciate it, is the cost of what all this is going to take to fix Bragi to where we're not having those issues anymore. And I wish I could tell you that there's a simple answer to that. You know, that, again, I fully expect even with surgery on those knees that we're going to have arthritic change. We've already got some. And we're not going to stop that from happening in the knees. So his future plans for Bragi is going to be some management of arthritic changes as he continues to age. And that can happen. There's things that you can do to help Bragi to be comfortable even after surgery is done. So what are we expecting with surgery? Let's talk about the hip first, and that's a femoral head ostectomy. It's pretty straightforward. You make a incision over the hip, you go in and remove the ball of the femur and allow it to heal. The femoral head ostectomy typically runs about $1,400. Somewhere thereabout, depends upon the time in surgery. That's total cost. That's an anesthesia with the surgery and with the pain medicine, hospitalization, things that he's going to need. The knees are a little more complicated discussing surgery on those because first of all, we need to see how much rotation of the tibias that we have. So the first step in that is going to be to get a better x-ray that are going to give us a little bit more answer to what type of surgery he needs. If it's just the medial patella luxation and we don't have to fix the tibial rotation, that typically runs about $1,500 to $1,600 per knee. If we have to do what's called tibial crest transplants where we straighten out the rotation of the tibias, you're adding about another $500 to that procedure. So you can see, unfortunately, that we're talking about several procedures on several different joints over a longer period of time. We would not do all these at one time. He would have to have one, heal from that, move to the next, heal from that, move to the next. So it's an investment. in both Bragi and with the full realization also that we're not making him perfect. We're trying to catch up on something that is already in some pretty advanced stages here. But I'm not saying it can't be done. You know, to make him more comfortable than what he is right now is our goal. That's really the whole goal of this whole surgical talk that we're talking about here is what can we do to make Bragi comfortable? And so those procedures that I described there is what would need to be done in whatever order that we deem it appropriate to make it happen.
Bragi needs help. I need your help to help him. He is too young to resign his life to pain until the medicine no longer helps him. He should get the chance to live like the young dog he is until arthritis catches up with him when he's old. Thank you for your time. Thank you for your love. I hope to see you again soon on another day and maybe with another dog. Have a great one. Bye.